Good day. I'm Dr. Rob Wilson. I'm the director of the Autonomic Center at the Cleveland Clinic. And this video is to really help you along. We do know when patients come to us nationally and regionally, especially through our ALFC triage, it can be very overwhelming and challenges. Many of you have been to many medical providers, much testing that comes back with not many answers and with a keyword uncertainty of where you're going and what are the next steps. We also know that coming to the clinic can be a very intimidating process. We call it high stake visits. You're coming, much is happening quickly. So this video is really a help along to sort of guide you and what could be to expect. One is we respect and know that you're going through a lot. And this is really to give you some help. One is we spend a lot of time getting ready for the visit. When you reach out to us, there's much time and effort reviewing your records that maybe you send to us, and also through the electronic portals that we can see nationally, regionally, and through Epic, the electronic health record. So we've had much time meeting, reviewing, collaboration, conversations to review your records and to organize the visit. So when you come to us, we know much of the data and the prior experiences that you've gone through. So when you come to us, we really want to know what you are going through in your symptoms and your daily experience, possibly just a day in your life, what you've gone through. And with that, we don't really want to bog down the visit with what this person said to you before, that person said to you before, but really you and your story and a day of your life. That is what matters. Also, what's important in the visit is to do a very detailed neurologic exam. The exam tells us so much. We use this exam so much in neurology to tell what's going on with people diagnostically and also to guide us into the future with the testing that you may have with us to forecast where you may be going into the future. This exam may take 5, 10, 15 minutes to do. So that's part of that visit that might take 45 minutes to an hour to do. And that really is as important to us as maybe the testing you've had done. Often the neurologic exam may have been not done completely or downplayed in its significance, but it's paramount in the medical care of a neurologic patient, especially autonomic patient, with vitals, sensory exam, strength, looking in your eyes. These are very important aspects. When you leave the visit, we may not have all the answers or the plan. This is true. Autonomic patients have high complexity. This visit may still leave you with uncertainty because autonomic is challenging, often don't come with easy answers. We may still be piecing the puzzles together of your own unique puzzle. There might be testing and some more answers and data to collect. That's why when you leave us, we might be still putting more testing together and more data collection. That's why we do want you to sign up for the My Chart, because we will still be doing collaboration outreach to you to maybe send a little message here and there saying, this is what we need, this is what we're thinking and thinking about you. It is hard when you leave us because there's still that uncertainty or feeling of trust or fear of what is next. We are still thinking about you and doing work on you when you leave us. That's why the My Chart's important. Many of the testing that's done for you that's autonomic, it's lots of numbers, a lot of data assembly, and it takes a while to process. Some testing may come back in 1 day, 2 days, and some can actually take up to 21 to 28 days to process just the number assembly and the sheer processing. It is not easy to be an autonomic patient. So when you go back home, there is still processing and waiting of what are the next steps. Again, uncertainty, trusting, fear, and waiting. Not easy to be an autonomic patient. For many of our patients, especially with orthostatic, that dropping blood pressure, poor blood flow regulation, and POTS, postural orthostatic tachycardia syndrome, we have implemented over the last decade was worked very well, and we have known from our data and statistical analysis and patient experience what works very well from feedback is working in groups and education, a community approach, using education, patient empowerment, a patient graduating patient-assisted exercise appointments. We really encourage our patients to work with this new Zoom format that we've been doing, with also scheduled down the road shortly afterwards a one-on-one virtual or in person, preferably virtual for the people who are more of a distance Zoom appointment. We find these Zoom appointments that are done in collaboration as a group of patients, and I lead them, help very well for our POTS and often our younger orthostatic patients. It may seem very intimidating, and this is not maybe what people want initially, but we encourage our patients to do these. The data and experience shows that this education, tools, empowerment, and next steps help people greatly. It may seem odd, weird, and not what people want initially, but overall, if people can be encouraged to do this, it does help. And this is something we really do encourage our patients to do. It's been a very positive experience, and as unique and different, does help long term. So we do encourage patients who come to us nationally to do this type of care once they have a diagnosis of a younger person, orthostatic or a POTS, to really have more tools to help them. Long term, we will guide patients who come from a bigger distance about how to have best care locally, since we are a distance, so they have more accessible care. One thing important about us is that we are an autonomic team of physicians, psychologists, nursing, advanced practitioners, and nurse practitioners, medical administrative assistants, research, and many other people. We are a very diverse team that's dedicated to patient care, medical education, quality improvement, and training people. With all that creates lots of diverse responsibilities to the Cleveland Clinic, regionally and nationally. With that creates a lot of demands, but also that creates this important sensitivity that we feel helps understand the special role and uniqueness of what the autonomic patient endures. It can create sometimes a challenge for the autonomic patient because of care needs they have, because we are very a specialty group of providers, because we do are very fringe and unique, and we are needed, but we also have the sensitivity to understand what you go through in mind, body, and spirit. This is really a video just to help guide you about what happens before the visit, with the visit, and after the visit. We're so glad that you're coming to us. Again, this video is really made to understand. We know that it's not hard to be a patient coming to us and what you've been through, and really as a sign of respect and sensitivity, what you have endured. And thank you for coming to us. Again, I'm Dr. Robert Wilson, and we look forward to meeting you.